Hi, this is Raina Rakiki, and I just want to take a moment to talk about my experience working with myofunctional therapist Becca Rose. I went to see Becca because I was having a lot of teeth grinding issues and TMJ pain that unfortunately seemed to get worse the older I got, and I couldn't find a way to fix it. I had tried yoga, I tried chiropractic care, and nothing seemed to alleviate. So I thought, let me go see a myofunctional therapist. And my experience has been nothing short of amazing. In the time I started working with Becca, not only did I learn a lot scientifically about the anatomy of the mouth, but she led me through a series of exercises that not only has strengthened my tongue, my swallowing pattern, but now I'm finding that I sleep so much better. And that right there is worth its weight in gold. I continue to see better results the longer I go. And I'm just so thankful that I found Becca Rose.
Welcome to Mayo 360, the podcast, where we'll delve into all topics related to myofunctional therapy, including airway health, snoring, sleep apnea, TMJ, tongue ties, thumb sucking, and even bedwetting. As a myofunctional therapist, sleep coach, functional breathing instructor, and formal dental hygienist, I'm sharing stories and tips to help you identify if myofunctional therapy is right for you and how it can help improve your overall health. Visit the show notes and take our quiz. Is myofunctional therapy right for me? Are you ready to feel better? Find the quiz to see how myofunctional therapy can help you and your family live your best life. Hello, this is Becca Rose, host of Mayo 360, Better Solutions for TMJ, Better Sleeping, and Better Breathing. Thank you for joining us again today. What I'd like to talk about today is the impact that mouth breathing has on children's health. We see kids with their mouth open all the time, but we do know that mouth breathing can have a serious impact on their overall health from a dental perspective to a sleep perspective, and even the way that their facial structures develop. So, in today's episode, I want to talk about why mouth breathing matters and how you can address it before it becomes a bigger issue. So, first, let's talk about why mouth breathing is such a big deal. We don't often think about our breathing, right? Because it's something our body does automatically. We have to remember what our noses are for. Our noses are specifically designed to filter the air, warm and humidify the air before it gets into our lungs. Our mouth is not designed to do those jobs. So when kids are breathing through their mouth, they end up bypassing all of those natural filters and processes that happen in the nose before the air gets to their lungs. This can increase dryness of the mouth and the throat. It can increase the risk of infections, both respiratory infections and head and sinus infections, especially because the air isn't being properly cleaned and filtered. And so mouth breathing is not just affecting the mouth, it affects oral health, cavity production. It can impact development of the face and the jaw. And this is really important because the way we breathe directly has an impact on how the facial shape and the skeletal muscles respond within the head and face areas. Mouth breathing can change the whole trajectory of the growth pattern of the face. So, this is a really important thing to be aware of, even when littles are little babies. So, what is happening when kids are mouth breathing instead of using their nose? We talked already about dry mouth can lead to bad breath, gum disease, increased risk of cavities, tooth decay. When the mouth is dry, the saliva loses its ability to have that protective barrier over the teeth. It's not able to do its job to help with cleansing. So then that means the bacteria in the mouth is able to run a little bit more rampant and do more damage on the teeth and oral tissues. Chronic mouth breathing, it also contributes to that incorrect jaw development, like I talked about. This impacts teeth. Are teeth going to come in crooked? Are they going to come in straight? Is there even room for the teeth to come in? It's important to know that when the mouth is open, the tongue is down. And when the tongue is down, it's not up. But if it's not up, it's not helping to shape that nice wide upper jaw. The jaw then gets more crooked and compressed, making it much more likely to have crooked teeth and an improper bite, which is almost a guaranteed recipe for some sort of orthodontic intervention. Over time, though, this crooked mouth and this improper bite can then go on to lead to TMJ problems, and the jaw can become painful. Chewing, swallowing, speaking, even sleeping can become much more uncomfortable if we have very crooked teeth and an incorrect bite over a long period of time. As they get older, we find that the adults that come to us in the 30s and 40s, I'm like, yeah, I have really bad clenching, grinding TMJ. And now I think back, I was a mouth breather my whole life, and I've always been congested. So I wasn't able to use my nose. So then we start to put all those little puzzle pieces together. All right, I want to talk about something a little bit less obvious, how mouth breathing can affect your child's overall sleep quality and their energy levels. So, if you have a kiddo who tends to have their mouth open a lot of the time, I bet you also notice that they drool snoring. So, you can either snore through your mouth or through your nose. Snoring in children, in many cases, ends up turning into sleep disorder breathing or sleep apnea in adults. So, this is another thing we really want to try to catch early. If we can guide the young kids to keep their mouth closed, then they're less likely to have some of the sleep problems that a lot of adults come here for help with. Again, they're like, oh, yeah, this was me as a kid. And here's another thing we're trying to address now when they're a child or they're an adult versus when they're a child. So, bad sleep means bad behavior in a lot of cases, and concentration is harder. So, we know that already that poor sleep equals behavioral problems. And just recently, the American Association of Pediatric Dentistry finally has recognized that there is a direct connection between sleep disordered breathing, sleep apnea, and behavioral issues in children. So it's really amazing that the Pediatric Dental Association is starting to understand the role that airway and sleep quality plays in overall health, not just dental health in children. All right, so let's talk about symptoms. So a kid with a mouth open doesn't have to look like their chin is laying on the floor. This could be a slightly parted mouth with while they're maybe watching TV, they're playing on a tablet, or they're just chilling out and relaxing. If their lips are often dry and chapped, or they're a kiddo who tends to lick their lips, these are other things too that tell us, hey, there's some things going on with mouth breathing that's a little bit beyond just having normal dry winter lips. Oral posture, one of the best things that we can do is to start guiding our kids into correct oral posture. So, what does that mean? Oral posture, the lips are closed, tongue is up, teeth are just slightly apart. Now, this sounds like a really easy thing to do, but oftentimes it's not. And people come here and they're like, why is it so hard to put my tongue on the roof of my mouth? Why doesn't it just do that? I should be able to just do that. And sometimes that's part of what we have to teach you how to do. If you are having suspicion that your child is having trouble breathing through their nose, you might want to reach out to either a dentist or their pediatrician because sometimes there's a reason like enlarged tonsils or enlarged adenoids that can contribute to that mouth breathing. We put together a really easy quiz that can give you some answers right away. It's a really helpful guide to just get some understanding of, oh my goodness, I have this. I maybe could benefit from a myofunctional therapy evaluation. So go to the show notes and check out that quiz to see if this is something that can help you or your kid have an easier time in life. Then you can also think about breathing more through the nose. What's really nice though after the quiz is that you'll get a nasal exercise, a nasal breathing exercise that will get emailed to you as you're going to incorporate some nasal breathing activities with your kids, find the video that's attached to the quiz, and it'll just be a good way to help get you jump started on a nasal breathing activity for your kiddos. So, last episode 26, I met with an orthodontist, Dr. Ethan Just, and he is taking myofunctional therapy classes and getting trained in Airway. And we talked a lot about how the muscles and the teeth and the jaw and the airway all work together. So that might be a really good episode to go back and look at. Episode 26 is the one right before this one, and learn a little bit more how that poor oral posture or that mouth breathing can be a contributing factor to how the teeth come in crooked or there isn't enough room in the upper jaw or in the airway. I just want to wrap up. It's important to recognize when children have their mouth open and all of the different things that it can contribute, not even just as a child, but also as an adult. The mouth breathing child ends up being the one who can't breathe through their nose. It's chronic. They have horrible allergies. They're grinding their teeth or wetting the bed. And then they become adults, maybe that have sleep apnea and TMJ, and they can't get their teeth to fit well together. And they just have facial tension and pain and things that they've been dealing with their whole life that end up snowballing as we get older. I want to make sure that the mouth breathing is not a habit, because if it's a habit and there's just something they're used to doing, then we can help them. But if it's not a habit, that's where your doctor, your airway doctor, or your pediatrician is going to come in to help make sure there isn't a blockage or a structural issue that's actually preventing them from breathing through your nose. So the good news here is that spotting these signs early when kids are younger and taking action can help prevent long-term and short-term and immediate problems. We want to help you get to the root cause. And if we're not the ones to help you, we know someone who can. So reach out and we will guide you in the best way that we can. So thanks again for tuning in. Be sure to come next time. We're going to talk a bit more about why snoring is dangerous. So we're going to elaborate on this topic today a little bit more. But until then, take care and we'll see you soon. And now for the fine print. The information presented in this podcast is for educational purposes only and should not be taken as medical advice. We recommend consulting with a qualified healthcare professional for any questions or concerns you may have regarding your specific health condition.